Hi, this is Dr. Greg Campbell, and welcome to this edition of Doctor Says. We all know how important brushing is, but brushing is only part of the equation. We know that periodontal disease and decay often happens in between the teeth where brushing can't get into. So that's why flossing is a partner with brushing. So today we're going to show you how to floss properly. Okay, let's get started. The first thing you need is dental floss. People say, do I need waxed or do I need unwaxed? Basically, I don't have a real strong opinion one way or the other on that. So just as long as you're using floss, I'm happy. So what we're going to do is show you how to take the floss and get the right. What I tell people is to take the length of about 18 inches. Well, most people don't have a tape ruler handy, but you do have a forearm. So what you want to do is take it down, take it the length of your forearm, and take off that excess amount. That's going to give you the amount that you need to floss your mouth, about 18 inches. Once you have your floss and about 18 inches of it, you're now going to wrap it around your middle finger. On each side, you're going to wrap it around. Then you're going to hold the floss with your thumb and your forefinger. That gives you the control in your mouth of being able to go in between the teeth and do the proper job. Okay, now that we've got everything positioned here and you're holding the floss between your thumb and your forefinger, you're now going to take it and you're going to gently slide it in between your teeth. Now most people think they're done at this point, but you're not. You're just getting started. You really want to use something called a C. You're going to bend it against the tooth. You're going to go down into the sulcus. You're going to push it in about 5 or 6 times. Now remember, you got 2 teeth there. Now take it to the other side. You're going to be pushing that down in as well. Then you bring it out. So it's not just going in and being done. You're going to actually come in, slide it down, and go into the sulcus about 5 or 6 times. You can do it more if you want. And then you're going to go down on the other side. Going along, you're going to now wrap the floss on your right finger and unwrap it from your left finger so you have fresh floss as you're going around through the arch. It really is that simple. It's important to do. So what you're doing is you're actually removing any debris from in between your teeth. You're reducing the bacteria count, but you've got to get your gums in shape. The whole point is getting in shape. So think of it, the analogy I use is, let's say you've never swung a hammer before and you go out and you swing the hammer for an entire day. Well, at the end of that day, you're going to have blisters on your hands. Well, after you do that for 3 or 4 days, you're going to actually have calluses. You actually get your hands in shape for what you're doing. You've got to get your gums in shape. It generally takes about 14 days to do that. Also remember, it takes 21 days to create the habit of flossing. It takes 3 days to break it. So remember, only brush and floss the teeth you plan on keeping. That concludes my latest edition on Doctor Says regarding flossing. If you have any questions or would like to know more about it, please contact our office, and I look forward to seeing you for our next edition of Doctor Says.